Hello and welcome. My name is Alice, and I'll be in the background answering any Zoom technical questions. If you experience difficulties during this session, please type your question into the Q&A. We encourage you to submit written questions at any time during the presentation using the Q&A function, which should be located at the bottom of your screen. With that, I'd like to introduce Lawana Welch, Section Chief of the Justice Involved Reentry Service Oversight Section.
Hello, good morning, welcome, and thank you for joining us today for our second office hour session focused on the recently released Behavioral Health Readiness Assessment template. We hosted a session on February 22nd to provide an overview of the template and answer preliminary questions from county behavioral health agencies that were in attendance at that time. This is a follow-up to that meeting. We recently finalized the Behavioral Health Agency Readiness Assessment template, which all county behavioral health agencies must submit before going live with their behavioral health links as part of the CalAIM Justice Involved initiative. The readiness assessment was released via email on February 27th and will be posted to our website shortly. Next slide. Today's agenda will repeat some of the key portions of the last presentation for those agencies that were unable to attend, then spend most of the time responding to your questions about the template and submission process, now that you've hopefully had some time to review the final template in advance of today's meeting. Before we get started, just a reminder, you can submit questions at any point during the webinar using our QA box at the bottom of your screen. We'll be collecting those questions throughout the presentation and we'll respond to them during the second half of the meeting. Now I will hand it over to my team member, Cassie Sea, to go over the Justice Involved Initiative and behavioral health links.
Good morning. As Lawana mentioned, I'll be going over the behavioral health links. Next slide, please. Behavioral health links are one component of the Justice Involved Initiative. Behavioral links were created under Penal Code Section 40111.11 to implement a process requiring correctional facilities to facilitate referrals to county special mental health services, drug Medi-Cal, the drug Medi-Cal organized delivery system, and/or Medi-Cal managed care plans for incarcerated members who received behavioral health services while incarcerated to allow for the continuation of behavioral health treatment. Next slide. Behavioral health links promote continuity of treatment for individuals who received behavioral health services while incarcerated. DHCS will require correctional facilities to facilitate referrals to post-release behavioral health providers and to share information with the individual's health plan. Behavioral health links will be implemented by correctional facilities, county behavioral health agencies, and managed care plans. These entities must implement links to behavioral health providers to achieve behavioral health care initiation or continuity through professional-to-professional clinical handoffs. Processes for facilitated referrals and links to continued behavioral health treatment in the community for individuals who receive behavioral health services while incarcerated. Behavioral health links will be facilitated by county behavioral health agencies, pre-release care managers, and correctional facilities, including referrals and professional-to-professional clinical handoffs for individuals exiting incarceration to county behavioral health plans, including county and managed health plans and/or DMC/DMC-ODS. For individuals with non-specialty mental health needs, links will be made to Medi-Cal managed care plans or fee-for-service providers. Now I'll be handing it off to my colleague, Jill Mitchell.
Hello all, I'm really happy to be here today and happy that we're going to be able to answer questions as I come off the video screen. There we go. I'm going to be talking about Behavioral Health Agency Readiness Assessment requirements and processes. Hopefully you were able to see all of this when you looked at the readiness assessment before. So all county health, please change slides. Oops, next slide. All county behavioral health agencies are required to submit a readiness assessment demonstrating readiness to participate in behavioral health links. All behavioral health agencies must receive DHCS approval prior to going live with the BH Link services. The BH agency's readiness assessment consists of attestations and narrative responses across 6 focus areas. The first is data sharing, pre-release planning, professional to professional clinical handoff, follow-up post-release, Medi-Cal billing, and overall program and initiative oversight. For each attestation, behavioral health agencies should indicate if they meet the requirement currently, if they are on track to meet the requirement by October 1st, or if the agency is not on track to meet the requirements and is in need of TA from us at DHCS. And there's a space on the form actually to describe optional TA requests to us. You don't have to reply, but if you'd like TA, you can put it in there. Remember that each narrative response has a word limit, so you need to be concise. And please note that county behavioral health agencies can use PATH dollars to support planning activities necessary to determine readiness and may leverage information from their PATH JI capacity building program progress reports to build out relevant sections of the readiness assessment. Next slide, please. Behavioral health agencies must submit their readiness assessment template to DHCS by April 1st, and that's 6 months prior to the behavioral health links going live on October 1st, 2024. We've had several inquiries from county health agencies asking if they could get an extension. And so we have had, we've decided that we will grant extensions on a case-by-case basis, and that would push out your readiness assessment to be due on April 15th. So it's about a 2-week extension if you need it. We will approve it on a case-by-case basis. DHCS will either issue a formal approval for the extension or will schedule a TA call with you to better assist you in completing the readiness assessment. And please reach out to the Justice Involved inbox, which I'm hoping someone can put in the chat right now, if you have a request for an extension, and please include details on your rationale for the request of the extension. Next slide. As mentioned on the prior slides, county behavioral health agencies must submit their readiness assessment template by April 1st, which is 6 months prior to the go live, or by April 15th if you are approved for an extension. So let's walk through this just a little bit. So we're talking about different timeframes, and we're looking at whose responsibility is to do what. So February and March of 2024, we anticipated that you would be convening groups of leaders and professionals to complete the readiness assessment. And we've been here and will be here if you need additional technical assistance for completing that. In April through June, we're looking at possible extensions that can be approved by us. We want you to submit your readiness assessment using secure file transfer. And we want you to respond to questions and requests for additional information that we may have. During that period of time, we're going to be evaluating the readiness template submission and follow up with county behavioral health agencies to address any questions that they might have. July, we're going to be making final determinations for the readiness for go live and communicate those decisions back to county behavioral health agencies. July and September, if the agency is approved, you can prepare to go live with behavioral health links. If you're not ready yet, DHCS will, not ready yet, we'll notify DHCS where the areas are marked ready by go live. And if denied, we're going to help you create an action plan to make sure that you're able to get that by the 1st. And then October 1st, we go live, and that's the same regardless of when the implementation plan was submitted. The October 1, 2024 date for behavioral health links is because pre-release services and county behavioral health links go hand in hand. And once the pre-release services launch statewide October 1st, County behavioral health agencies will need to ensure they're able to receive a behavioral health link from any county jail or youth correctional facility across the state, even if the jails or youth correctional facilities in your counties have not gone live yet with pre-release services. We anticipate a volume will be initially small in counties whose jails or youth correctional facilities have not gone live, as the County Behavioral Health Agency will only participate in behavioral health links with individuals released from their county or other county correctional facilities that have already gone live with pre-release services or the state prisons. Once the county jails or youth correctional facilities have gone live with pre-release services, the county BH agency must participate in all aspects of behavioral health links with individuals being released from these facilities. Next slide, please. We will be determining a score for each focus area based on the Behavioral Health Agency's attestations and narrative responses. DHCS will determine the agency's overall readiness assessment score. The agency will receive an approved score in all 6 areas when they're approved to go live. So an approved determination indicates readiness in each area of the template. A not ready yet determination indicates the response meets some of the components of the template, but they need to have really clear time-bound action plans for any outstanding requirements by go live. And a denied determination indicates that the Behavioral Health Agency's response is incomplete or does not sufficiently address the narrative questions, or the submission does not indicate readiness to go live by go live date. If the Behavioral Health Agency receives a denied in any focus area, we'll work with that Behavioral Health Agency to determine an action plan to achieve readiness. Now I'm going to pass it off to my colleague, Charlotte Garcia.
Hello, everyone. My name is Charlotte Garcia. I'm an analyst at DHCS in the Reentry Oversight and Evaluation section. Today, I'm going to detail the format for the Behavioral Health Readiness Assessment template. Next slide, please. Each focus area has an attestation section. For each attestation section, the County Behavioral Health Agency must denote readiness status and a time frame to meet readiness for each minimum requirement by checking one box per row. In addition, there is a space where agencies can optionally provide details on TA requested. We've included an example of the attestation section below. Next slide, please. For each narrative response, County Behavioral Health Agencies must provide answers to the indicated questions and abide by word counts. We've included an example of what you should expect to see for the focus areas with narrative responses. And now I will hand this off to Megan Shandell of DHCS and Maya Shashua of Manat for our Q&A time. Thank you.
Hi, everyone. Good morning. My name is Maya Shashua. I'm a consultant with Manat Health supporting the DHCS team on the Justice Involved Initiative. And welcome folks submitting Q&A through the Q&A box. I know we got some questions in advance and also see a couple coming through now. So we'll kick things off. The general question, Megan, I'll ask this of you. How will these behavioral health agencies submit their readiness assessment to DHCS? And where can they find a copy of this readiness assessment as they work on filling it out?
Right. So behavioral health agencies can submit their readiness assessments to DHCS using the CalAIM Justice Advisory Group email address. Maya will copy that into the chat now for you guys to write down. That is also where you'll submit any extension requests that you may have. We've run into some unexpected delays in getting the assessment template posted to our JI webpage. Once that is posted, it'll be live on the website. If you need a copy in the meantime, please also submit a request to that CalAIM Justice Advisory Group email address, and we will provide you one as soon as possible.
Great, thank you. And another similar question, someone asked, under what circumstances extensions may be granted to April 15th?
So counties are encouraged to submit a detailed rationale along with their extension request. And DHCS is committed to reviewing those on a case-by-case basis. Everyone's situation will be different, so we don't want to provide too many examples of what would constitute an approved request, but we're willing to work with the counties, and if it's within reason, going to approve those or offer some TA to get you guys ready.
Super. Another question that came in pre-submitted was a question asking, will a list of the facilities that have gone live or plan to go live be posted on a web page for reference from other partners in the county?
Yes, DHCS will be posting a list of facilities that have submitted their readiness assessments and intend to go live on our JI webpage, and that will be updated on a quarterly basis.
Okay, and turning to a couple other questions that we had come in. For individuals who have an unknown release date, when should pre-release services, which may include behavioral health services, begin?
So the aid code should be activated and pre-release services should begin as soon as possible for individuals with anticipated stays of less than 90 days, or for those with unclear anticipated lengths of stay at the time of entry. The release date is not needed to begin the 90-day period.
And I think a similar question, but maybe just making it crystal clear. If an individual doesn't have a release date, when should they begin receiving services as long as they qualify as a part of the Justice Involved initiative?
So the county should start pre-release services upon intake. The 90-day period can reset once an individual is sentenced and a new release date is established. This scenario is outlined in our policy and operational guide in section 6.1. And then if somebody from the Manat events team could post the link to the policy guide on our webpage, that would be amazing.
Super. Then turning to we've gotten a few questions in, and I think we had a few from last session, focusing on the role of managed care plans and connection to post-release services. So one question that we received is clarifying what responsibilities managed care plans have for individuals who are re-entering the community who do not meet specialty mental health criteria. They would only be qualifying for non-specialty mental health.
The managed care plan will be responsible for ensuring the provision of non-specialty mental health services to the individual, including a behavioral health link facilitated by the pre-release care manager.
Great. And following up in a similar vein, if the behavioral health link is planned or it occurs, does the incarcerated individual still have to be connected to enhanced care management services upon their release once they are in the community or upon their release during their release time?
Yes. Individuals who are identified for behavioral health links should still receive a warm handoff to their ECM post-release provider if their pre-release care manager does not continue with them in the post-release setting as their ECM provider. The pre-release care manager and or post-release ECM provider, if different, may assist in the behavioral health link to specialty mental health services, DMC or DMC ODS, if appropriate. If the individual is identified as only needing non-specialty mental health services, the care manager will help facilitate a BH link to managed care plan or the fee-for-service provider.
Thank you. Shifting gears a little bit, I think we've gotten a few questions about billing. So first question is asking whether assessments, including assessments for behavioral health link eligibility, are billable and reimbursable.
It's a great question. Yes, pre-release assessments are reimbursable under care management once an individual's JI aid code is activated.
Great. And another billing question, if the same entity, so the County Behavioral Health Agency is providing pre-release behavioral health services, and they'll be a provider post-release. Do behavioral health links have to be billed for separately?
Yes, the County Behavioral Health Agency should bill CAMUS when acting as a pre-release provider. The only time they should bill Short Doyle in the pre-release period is when they are acting as a plan and receiving a behavioral health link.
No, billing is a topic that we've gotten a lot of questions about. So one more question on billing while we're on the topic. So question is, will county behavioral health agencies be able to bill Medi-Cal if the facility doesn't have an NPI number yet, or a mechanism to turn on Medi-Cal for the incarcerated beneficiary?
So correctional facilities must have an NPI number and be enrolled as a Medi-Cal clinic in order to be approved to go live with pre-release services. Billing for pre-release services cannot take place until an individual's aid code is activated.
Great. And I lied. I have one other behavioral billing related question for you, which is that someone asked when DHCS will share billing guidance or further information for CAMUS and for Short Doyle, particularly for the professional to professional clinical handoff component of the behavioral health link.
So this guidance is in its final stages, and it's forthcoming and will be available in advance of the first go live date.
Great. Let me just take a look at what else we've had coming in. All right, we have one question that is related to PATH funding. Someone asked if you all could speak a little bit further about the difference between the readiness assessment submission and the PATH implementation plan submission, and the difference between go live dates or any other information that you think would be important for folks to be aware of.
So, here. Behavioral health agencies are required to go live with the behavioral health links by October 1st, 2024, including the ability to receive a behavioral health link from any correctional facility that may be live with pre-release services. In the PATH Round 3 Behavioral Health Implementation Plan, the focus areas require the person filling out the implementation plan form to designate an expected go live date for that focus area. This date may differ from October 1st, 2024, as behavioral health agencies work to stand up their processes and systems in order to go live by October 1st, 2024.
All right, let's see. Looks like we got a question, which I think was covered a little bit in the slides, but someone asked you all to revisit the rationale for behavioral health links going live on 10/1/2024, but there, while facilities do not necessarily go live in every single county, as they have a 2-year-long period up until 2026 to go live. So they asked that you all clarify the rationale behind that.
So DHCS set the October 1st, 2024 go live date for behavioral health links because pre-release services and county behavioral health links go hand in hand. Once pre-release services launch statewide on October 1st, county behavioral health agencies will need to ensure they are able to receive a behavioral health link referral from any county jail. From any county jails, youth correctional facilities across the state, even if the jails and or youth correctional facilities in their county have not yet gone live with pre-release services. And also want to note that DHCS anticipates that your initial volume of those referrals received would be low until your county goes live.
Great, thank you. Another logistical question about the readiness assessment. Someone asked if county behavioral health agencies will be required to submit any policies and procedures or supporting documentation with their readiness assessment.
No, the readiness assessment will request attestations and narrative responses to support the requirements.
All right. Got another question submitted that someone inquired. Do we have the latitude to begin services for an individual after their sentencing?
So the mandate for the CalAIM JI initiative is to begin these services prior to release. If services cannot happen prior to release, there are specific form handoff requirements that are further outlined in section 8.4 of our policy and operations guide.
Super. Another more general question, are incarcerated individuals with inactive Medi-Cal not eligible for pre-release services?
To bill and claim for pre-release services, Medi-Cal must be activated, and the JI aid code must be turned on. Correctional facilities must follow required processes to enroll and activate Medi-Cal to bill and claim for pre-release services.
Great. Just taking a look at what has come in. Someone asked where they can find additional information on billing as a reference going forward.
Billing information can be found in section 10 of our policy and operations guide. And then we are also working to provide additional billing details, hopefully sooner rather than later. And then this information will also be available on our CalAIM JI webpage.
Great. And I will drop a link for that in the chat for folks if they have not had the chance to visit yet. Someone asked a clarifying question, just checking in if you could provide more information on the distinction between pre-release care management and post-release enhanced care management.
So care management is a pre-release service that must be billed fee-for-service while the individual is incarcerated. Enhanced care management is a managed care plan benefit that is only available once the member is in the community. ECM providers can bill for pre-release care management services under fee-for-service.
Great. All right, another billing question. So if a behavioral health assessment is completed within 14 days, as is set forth in the policy guide, but someone is released from custody later than expected, they're released perhaps a year later, can another behavioral health assessment be completed prior to release and be billed in order to ensure that that individual receives appropriate levels of care?
Yes, our short answer is yes on that. We're working to create some updated sections of the policy guide and hope to release that shortly. And so you'll see in the next version of our policy and operations guide, we will walk through scenarios where the 90-day pre-release services can be paused, reset, or restarted.
Great. And then another question on the extensions. Someone inquired if there is a deadline by which they have to request an extension or any information they should know about that submission.
Yes, your deadline to submit an extension request will be prior to April 1st.
Great. Let's see. Thank you all for these great questions. See them all coming in. All right. So another question that we've gotten is the County Behavioral Health Agency responsible for establishing behavioral health links to both the mental health plan and the managed care plan, or is the managed care plan responsible for their own behavioral health link?
So the County Behavioral Health Agency is responsible for establishing behavioral health links to those who will continue to receive their behavioral health care through the county plan.
Great. And we got another question relating to the PATH implementation plan, I think in follow-up to the answer you gave a little bit ago. Someone asked specifically, what the difference is between the expected go live date versus the path implementation plan expected date, and that those are different sections and they have some confusion about how to respond to that specifically.
Right. So your behavioral health implementation plan for Path Round 3 will read a lot like a budget narrative. And so you're just telling DHCS how you plan on spending your path funding for that focus area. Your behavioral health readiness assessments will read as how you plan on implementing the policy. And so they are similar yet different. And your go live dates referenced throughout the implementation plan for each of the focus areas is just telling DHCS when you're going to be spending that money to adhere or to stand up the process for that focus area. And if you have additional questions on that, we'd be happy to answer them. You can reach out to our PCG partners, who are our third-party administrator for the Path Round 3 grant. And then you can also reach out to our CalAIM Justice Advisory inbox with any questions you may have.
Great. Another question relating to PATH. Someone asked, to use funds for staffing, they would like to clarify if this can only fund a portion of the position, the staff position, for up to 6 months from the startup date.
So the PATH funding is intended to be one-time startup funds. And for this reason, funding for salary support will be capped at 6 months past your go live date.
Great. A general question, someone just inquired if this Q&A will be shared with folks who are attending the webinar, or if this will be publicly available.
I'm going to go out on a limb and say yes, because we've made them available for past office hours, but I don't recall that conversation for this one. So yes, I will commit to it.
Yes, I think we will be able to have this webinar recording posted. It does take a little bit of time to get it up, but that is on the DHCSJI website that was in the chat, and I'll put it in there once more, but it is not instantaneous. All right. Another question that came in asking whether behavioral health links are required for juvenile hall and other youth correctional facilities, as well as jails and prisons.
Behavioral health links are required for county youth correctional facilities, county jails, and state prisons.
Great. Thank you. Getting a bunch of questions, so just making sure I'm not missing any. Someone just asked a clarifying question overall on the Justice Involved initiative. They asked for entities, meaning correctional facilities, to claim for pre-release services. Those they wanted to clarify that those jails, prisons, youth correctional facilities will need to establish NPIs.
Yes, jails will need to establish an NPI number and enroll in Medi-Cal.
Great. All right. Another general question. Someone asked for behavioral health links to and from other counties, will there be a website or other source to provide guidance on who the provider is in each county or what their process is?
So DHCS encourages counties to build communication processes to support these scenarios, but we will not be posting or coordinating a web page to facilitate that.
Great, thank you. All right. Let's see. Someone asked, will behavioral health linkage services be uncompensated until pre-release services go live? Could they get some clarity on how that reimbursement will work?
So the counties will be able to bill short doyle for the professional to professional component of the BH links prior to a county going live with pre-release services. This is detailed in Table 17 on the policy guide, and then it lays out what can be billed and when.
Right, just taking a pause, making sure we've gone through, see what else is coming through. Thanks again, folks, for submitting questions. All right, someone asked a question about the correctional facility readiness assessment process. And they asked to get a little bit more information about the correctional facility readiness assessment submission and time frame for when those submissions are due for correctional facilities.
So correctional facilities must go live with pre-release services between October 1st, 2024 and September 30th, 2026. And correctional facilities will be able to go live on a quarterly basis during this 2-year period. They must submit their readiness assessment 6 months prior to the date they wish to go live on. And then DHCS will review and approve or provide technical assistance to get them to their target goals. For more information on the readiness assessment and the submission and the processes, we will have posted shortly to our webpage the office hours recordings for the 2 correctional facility readiness assessment office hours sessions that we held, one at the end of February and one last week. So those should be posted shortly. I know they're in their final stages, and I would refer you to view those, and then also you can ask your questions to our CalAIM advisor or Justice Advisory Group email address, and someone would be happy to respond to those.
Great. Another question that came in. So in the Behavioral Health Agency Readiness Assessment, if the agency doesn't need TA support, but they are worried about meeting the 10/1/2024 deadline, what should they check? Their ability to meet that 10/1/2024 deadline. They were feeling it may be based on whether pre-release services and other correctional facility related things are completed, which are outside of their control.
Right. So I think it would be really helpful if you just included that information in the narrative section of the question. And then me and my team, when we're reviewing it, we can reach back out if we need some more clarification, or provide TA if that's what you're needing.
Let's see. Another question. Someone asked us about youth criteria for pre-release services. They asked, since criteria for pre-release services for youth is just that they are a part of a Medi-Cal or CHIP eligibility group, they asked if there is another screening tool that they need to use for those services, or if that anything other than Medi-Cal or CHIP eligibility needs to be determined for that age group.
Yes, so youth, which is defined as 21 and younger or former foster youth between 18 and 26 years old, do not need to meet healthcare criteria to be eligible for pre-release services.
This is a specific question, but and I think maybe was submitted via email, but someone inquired about missing a deadline for their interim progress report, and if there could be some clarification on where they should submit the progress report to once it is completed, whether there's a template they should be using.
I don't have specific information on the interim progress reports. I believe that may be in reference to PATH rounds 1 or 2. And so our team only deals with path round 3. If that is your situation, I would encourage you to reach out to PCG and ask this question of them. And hopefully Maya has their email address. She can post it, but they'd be more than happy to help walk you through that process.
We will track down that email address. I don't have it on hand. At worst, we'll
someone will drop it into the chat shortly.
All right. Got another few billing questions, which I know are common. So someone asked, what are the new billing codes for linkage services which are currently not covered by Medi-Cal benefits?
So all of the billing codes that we're working on for the Justice Involved initiative will leverage existing fee-for-service billing codes. DHCS has created 5 new care management bundles to support the delivery of pre-release care management. And then all of the guidance and details surrounding these codes and bundles is forthcoming and will be released prior to the go live date of 10/1 and hopefully well in advance of that.
Great. Oh, and I've got a message with the PATH email, so I'll just drop that in the chat for everyone. So that would be for folks that are in need of contacting someone relating to PATH rounds 1 or 2. Though, Megan, correct me if I'm wrong, your team and the Justice Involved inbox would be an appropriate contact as well for the PATH round 3.
Yes.
Great. While we're on the subject of PATH, another question, just clarifying that something that was said earlier. Someone asked to confirm that PATH funds for staff can only be used 6 months beyond the go live date, and wondered what would happen if positions took longer to fill than that.
So this information can be found in the guardrails for supporting staff salaries section of the PATH round 3 guidance, which should be linked to our JI website. And Maya will go ahead and drop that link for everyone.
That one I had on hand. So to the asker of that question, that's the link that I just placed in the general chat. All right. Let's see, other billing question. Can the county behavioral health entity be the one to complete and bill for the behavioral health needs assessment, even if they are not the designated pre-release care manager?
So behavioral health related pre-release services are the responsibility of the correctional facility, but the correctional facility may contract with the county behavioral health for completing those services.
Great. All right. Another question that came in, if a person is booked and released, do the pre-release care managers need to do outreach to that person and offer all of the JI services in the community, including behavioral health links? Is that one of the workflows that's set forth as a part of this initiative?
So once an individual is released into the community, they will have access to full Medicaid benefits, enrolled in a managed care plan, and have access to ECM. And the post-release case manager will be responsible for providing care once someone is released into the community.
Great. All right, I see just a few other questions coming through. I saw one further question on staff salaries. Just want to refer folks to the link in the chat with guidance that's more robust on that information. I think that's a good source to get a deeper level of information on staff salaries. All right, someone asked a general question. They asked what the process might be for getting added to the distribution list for the Justice Involved initiative, making sure that they are keeping up with any emails or webinars that are coming out and that they are aware of everything going on.
Please, please, please go ahead and send an email to CalAIM Justice Advisory Group at dhcs.ca.gov, and we will add you to the distribution list for all of that information.
Great. I'll just drop that in the chat again, at risk of putting it too many times in the chat. Let's see, I think we've got just a few more questions. Let me just make sure we've addressed everything. All right. Oh, one question again on timing. Someone just wanted to clarify that whether they are going to not have to provide behavioral health links to local custody referrals until their local correctional facility goes live. So maybe if you could describe a little bit about what folks can expect once they're live with behavioral health links if the correctional facility is not live in their county.
So we encourage you to develop these relationships with the referring counties. Your process may look different across all those counties. Those county correctional facilities may reach out to you and ask you what your preferred process is. But we encourage you to work together. And they may have an individual that is releasing to your county, and it's entirely up to the two of you to work out what the process will look like and what the actual referral process or transaction ends up being.
Great. All right. I think we might be towards the end. Oh, okay. One question that came through, someone inquired whether behavioral health plans, county behavioral health agencies will be contacted by CDCR, the state prison system, regarding behavioral health links for people leaving state prisons.
Once CDCR goes live with pre-release services, yes, they will be sending referrals to the counties that they are releasing to.
Great. And I think this is our final question. And it was just a confirmation of whether behavioral health agencies would bill for the pre-release behavioral health assessment that got asked a minute ago. So just want to clarify whether they would be billing or not, or under what circumstance they would bill.
So the correctional facilities, again, are responsible for ensuring pre-release services are provided, including the behavioral health assessment. The billing for these services should be done under the Correctional Healthcare Facilities NPI number. If county behavioral health has been contracted to provide those services in the pre-release setting, it would be billed under the Correctional Facilities NPI number.
Great. All right. I think that is all that we have coming through. Oh, I see one final question to close us out. Someone just followed up on state prisons, CDCR. They asked if there is an awareness of whether when CDCR may go live during that 2-year time frame.
So we're engaged with CDCR in regular stakeholder meetings, and when we get closer to solidifying a go live date for them, we'll post that on our webpage and communicate that to you guys at that time.
Great. Thank you. I think that does it for all of our questions. I know that was a lot, and thanks folks for submitting them. And again, if you submitted a question that we missed or you had a follow-up question, that Justice Advisory Group email is in the chat. Otherwise, Megan, I think I'll hand it back to you to close us out.
Awesome. Thank you so much, everyone. I think Lawana is going to share kind of like a next steps and then close us out. So I'll pass it over to her.
Thanks, Megan. Next slide. We just want to remind everyone, we'll continue to offer technical assistance to you as you complete your readiness assessment templates and prepare to go live with behavioral health links on October 1st. Next slide. And we want to thank you. This is the end of our presentation for today. Thanks for making time to attend this office hour session. If you have any additional questions or technical assistance requests, please submit them to our Justice Involved inbox. It's in the chat. It's CalAIM Justice Advisory Group at dhcs.ca.gov. And that's it, everybody. Have a great day.